Good afternoon, everyone. I'm going to give everyone just a minute to get in and then we will get started. All right. All right, welcome everyone to our monthly webinar series of the Virginia Governor's Conference on Aging. My name is Martina James and I manage the Governor's Conference on Aging, and I want to thank each of you for taking the time to join us today. The webinar series was started in June due to the need to postpone our in-person conference, and our partners, our conference partners and steering committee, due to the pandemic, postponed that conference to May 17th and 18th, 2021. But in efforts to keep attendees and presenters and partners and sponsors engaged, we've built this webinar series. We hope you continue to join us for the fourth Tuesday of each month from 1 to 2 p.m. Before we get started, I want to thank all of our sponsors who have made this conference and webinar series possible. Virginia Housing is our featured sponsor this month, and we want to also recognize our two featured exhibitors, the State Corporation Commission and the Virginia Coalition for the Prevention of Elder Abuse. They have continued to support this series throughout our conference transition, and we hope you'll take a few minutes to learn about them by visiting our website, which links to each of their respective websites. You can also learn more about all of our other sponsors and exhibitors that will be joining us throughout the webinar series and at our conference in 2021. A couple housekeeping measures. We'll be taking questions at the end of this session. I encourage you to type questions in the question box as, excuse me, sorry, I didn't realize I wasn't sharing my screen. I encourage you to type questions in the question box as as the presentation goes on. We often have more questions than we're able to answer in our 1 hour slot, and so we'll be sharing our panelists' information and we encourage you to reach out to them for more information at the end once we've run out of time. This webinar is being recorded and will be posted to VGCOA this afternoon. Each of you will get a follow-up email with a link to the posted recording, some information with contacts of our webinar panelists, and a quick survey we ask you to fill out regarding topics and future topics. We're interested in hearing from you about what you want to hear about as we move forward. Last month, we hosted our first of a two-part series addressing social isolation and community-based services. This month, I'm thrilled to have three phenomenal panelists to share their experiences and the best practices in addressing social isolation in long-term care facilities. Our three panel members are Melissa Andrews, President and CEO of LeadingAge Virginia, Sarah Lineberger with the Virginia Department of Health, and Secretary Richard Prudom of Florida Department of Elder Affairs. At this point, Melissa, I will hand it over to you and we can get started.
Thanks, Martina. Welcome, everyone. We're so glad that you could be with us today. Long-term care providers do not just care for older adults in the latest years of their lives. They also create community. What COVID-19 has revealed to our sector is the tension between doing everything we can to save lives, but that might also sacrifice the very quality of life we were seeking to create. Long-term care providers have been on the front lines of this fight. Some had to start quarantining their residents as early as March 1st. Imagine not seeing your loved one for this many months. I know many of you are in that very position. What we need to remember above all else is that these providers have answered the call without the support they so desperately needed. Lack of PPE, lack of testing early on, the ongoing workforce crisis, and a highly communicable virus put them behind the 8 ball as they began to fight this fight. I liken it to sprinting a marathon with no finish line in sight, because they had to activate their emergency preparedness plans that normally only last for, say, 4 to 7 days, maybe longer in Florida, Secretary Prudom. But they had, knowing that they would never know when they could deactivate them. We are used to activating them for a hurricane, but there's always an end in sight. And there isn't with this until a vaccine is found. But with the challenges of COVID, there have been opportunities to find incredible creativity and innovation as we support our residents and clients who have been socially isolated for so long. Before we learn more about that, I want to turn it over to Sarah Lineberger, and the Department of Health has been an incredible partner to us and an incredible advocate for our sector as we've gone through this crisis, and I'm so grateful for your leadership, Sarah, and that of your colleagues. I turn it over to you.
Thanks, Melissa, and thanks everyone for joining today. We're excited to have this hour to talk about this important topic with you all. And I'm bringing the perspective from the Virginia Department of Health and our public health response to the COVID-19 pandemic. Just to give you a little bit of background, in Virginia, we have 287 nursing homes and 565 assisted living facilities. The nursing homes are licensed by the Virginia Department of Health Office of Licensure and Certification, and the assisted living facilities fall under DSS, the Virginia Department of Social Services. And when we think about public health and our response across the state, we operate in 5 regions. And so on the map, if you just go back one slide. We have 5 regions, and you can see sort of the breakdown across the regions. And the reason I'm showing you these regions is just because I'm going to show you some regional data in a minute. But you know, all of the regions in Virginia are somewhat different, and the long-term care facilities in these regions have had different experiences with the pandemic. We saw a lot of early outbreaks in long-term care facilities in the northern region of the state and the central region of the state around the Richmond area, and the pandemic has sort of moved across the state. We've seen it more recently, a lot of outbreaks in the eastern region and now the southwest region of the state. And a lot of this information and work that we've done on the public health side has been part of the Virginia Long-Term Care Task Force, which I think was mentioned on an earlier webinar. The governor stood up the task force in April as a way to bring a lot of partners together. Melissa's part of that task force, and all the other associations in Virginia, and many providers and other state agencies. And so there's a link on your slide if you want more information on the work of the task force. You can view that later. You can go to the next slide. So we know that COVID-19 has really impacted long-term care facilities in a significant way. As Melissa was saying, you know, they've had to come up with a lot of creative ways to deal with the COVID-19 pandemic, and the facilities have just been overwhelmed in terms of making sure they have enough staff, enough supplies, etc. We've seen, and this is from our surveillance data, we've seen over 7,000 COVID cases in long-term care facilities in Virginia and over 1,200 deaths. And the deaths are significant in that the deaths in long-term care facilities have accounted for almost half of the total deaths in Virginia from COVID-19. So really a significant impact, and part of the balance in, you know, lessening the social isolation, but also preserving life is this, you know, the fact that we've seen the hardest hit for deaths and severe outcomes in these populations is really, it's really striking. If you go to the next slide. So just a little bit of background. We hear about reopening a lot, and we're mostly going to talk about the nursing homes and assisted living facilities today. But I did just want to make sure that everybody's on the same page. In Virginia, the communities have been reopening on a schedule called Forward Virginia, and that started in May 15th, and most significantly, the most recent reopening phase 3, started on July 1st in Virginia. The nursing home reopening guidance that we put out in Virginia aligns with both CMS and CDC recommendations, and the idea is that reopening a nursing home lags behind the community reopening by at least 2 weeks. And that's because we're really seeing that transmission happens in long-term care facilities when transmission is happening in the community. And that's part of the reason for some of the visitation restrictions that have been in place, is because when the virus is circulating in the community and there's spread in the community, we then see spread into the nursing homes via staff and other people coming in and out of facilities. And that then leads to transmission in the facilities. And CDC is starting to do some modeling around that so that we can look at community transmission and then predict outbreaks in nursing homes based on what's happening in the community and what's happening in the surrounding nursing homes. Like I said, assisted living facilities fall under DSS, and their reopening really hasn't been by phase. It's a different type of setting, provides a different type of care. They don't technically fall under CMS, and their reopening has been more facility by facility based and less prescriptive by phase. You can go to the next slide. So this is just to give you an idea of what the Virginia nursing home reopening guidance says by phase. And essentially, visitation is generally prohibited in both phases 1 and 2 for nursing home reopening, except in compassionate care situations. We have encouraged and have learned a lot from facilities who have come up with creative ways to allow for visitation during these first reopening phases, including window or outside visits. And I think Melissa and Secretary Prudom will talk more about some of the ways facilities have been able to do this. In phase 3, and we're not aware yet that any Virginia nursing homes have entered phase 3. In phase 3, visitation would be allowed, again, with precautions in place, but that's where we would really see visitation opening up. You can go to the next slide. So we do have many nursing homes in phases 1 and 2 in Virginia. This is another just sort of picture so you can see what we're thinking in terms of social and group activities in nursing homes by phases. In phase 1, we would generally say restrict group activities. In phase 2, you could open up group activities and outings a little more, limiting the size of those activities to no more than 10 people. And then in phase 3, we would allow more group activities and outings, again, taking precautions in all 3 phases, but allowing more activity in phase 3. And actually, on a couple slides back, I did post a link to a CMS FAQ document about visitation that was published a couple months ago, and we found that really helpful with some more clarification about nursing home reopening phases and visitation specifically. You can go to the next slide. And then this is just pulled from the DSS assisted living facility reopening guidance. And again, it's a little more facility by facility. Visitation is generally limited at first. And again, visitors should be screened and other precautions should be taken. And same idea with communal dining and group activities. If there are residents not infected or not suspected to have COVID-19, those activities may gradually resume with social distancing requirements in place. You can go to the next slide. So this is the data that I wanted to show you. This is looking at the pandemic over time from middle of March until yesterday, so middle to end of August. And this is data by region. So you can see that each of the 5 regions is a different color on your screen. And these represent outbreaks in long-term care facilities. So that includes nursing homes and assisted living facilities. And you can see that there was, if you just look at the overall sort of graph, you can see there was a peak in long-term care facility outbreaks in end of March, beginning to mid-April, and then that decreased. So some restrictions in terms of visitation and a lot of social distancing restrictions, face covering, et cetera, went into place as we sort of got a handle on the pandemic, and overall outbreaks in long-term care facilities decreased in Virginia. We did, like I said, move into the community Forward Virginia phase 3 on July 1st, and you can see that the outbreaks in long-term care facilities did increase after July 1st. sort of increased in July and have gone, not a perfect curve, but sort of up and down and still remain elevated into end of August. And so again, that sort of underlines the general idea that when you have transmission in the community, it can come into these facilities and then spread pretty quickly. You have a lot of people at high risk in these facilities, and in nursing homes, you're not able to put as much social distancing into place as you might be able to in assisted living facilities or other types of settings. But it is also interesting to look at this graph by region. So you can see the light blue, the northern region. Like I said, they had a lot of outbreaks early on in the pandemic, end of March, April. And most of their nursing homes actually have experienced outbreaks. So that has decreased in the northern region, but we have seen uptick, like I said, in both the eastern, which is the light green, and now the southwest regions, which is the darker blue color, as COVID transmission has sort of spread across the state of Virginia. So it's just interesting to sort of see the overall picture of what's happening in long-term care facilities in Virginia, and then what's happening by region, because every region of Virginia has experienced this pandemic a little bit differently. So I thank you for sort of wading through the data with me, and I'm going to turn it over to Secretary Richard Prudom for some more on what's happening in Florida.
Thank you, Sarah. That was some interesting information, and I'm going to share that with your colleagues over here at the Florida Department of Health. I know they'll be interested in that as well. But just to give some perspective on Florida, we have 20.8 million people here in Florida, and 5.5 million of them are actually over the age of 60. To put that in a little bit of perspective, our senior population outnumbers the senior populations of 20 other states combined, as well as the total population of Alaska, Delaware, both the Dakotas, Rhode Island, and Vermont, and Wyoming. It's interesting when you look 100 years ago, when the Spanish flu was killing over millions of people across the globe, the average life expectancy in the United States was 54, and now it's 78.5. And as we know, we're all living longer because 20th century medicine successfully contained those infectious diseases. And obviously the world of medicine is working to do the same right now with COVID-19. But as we know, even though we're living longer, there's a growing prominence of chronic illnesses such as dementia, osteoporosis, heart disease, and stroke, and those associated disabilities. And, long-term care is that help that needed to cope when those disabilities impair the ability to perform the basic tasks of everyday life. And we have heard a lot about long-term care during this pandemic, and Sarah alluded to a lot of the situations that are happening in the long-term care facilities in Virginia. Here in Florida, we have about 4,000 facilities throughout the state. The average occupancy was about 170,000. Now it's down to 150,000, as several families have taken their loved ones out of those facilities because of concerns about COVID. Obviously, just like every state, we do provide long-term care to over 700,000 adults every year in the homes and communities. And as we know, just like in Virginia, we have COVID has a disproportionate impact on older adults. And here in Florida, adults over 65 comprise about 15% of the positive tests for COVID, about 50% of the hospitalizations, and 83% of the deaths. The stats this morning were 605,000 positive tests, 37,000 hospitalizations, and 10,580 deaths. And like I said, 83% of those were for older adults. And we experienced what Sarah was saying as well, was about half of those deaths originally were in those long-term care facilities. But in talking to our Surgeon General this morning, he's sort of seeing where that is now changing, where you're seeing more deaths occurring over the 65 and older group actually from spread in the communities. So you're not seeing so many people in those facilities dying, but they're sort of catching it from younger adults in the communities. And that obviously is causing great concern because of the disproportionate impact on those older adults. So I know that obviously Florida will be is attempting to address that, as will Virginia and other states. So obviously, as we know, reducing exposure for older adults is especially important in all of our states, and as well here. And just like Virginia, we have older adults have been confined to their homes because of executive orders, community regulations, and indeed self-isolation. And the visitation to long-term care facilities has been suspended to protect them from exposure. You know, I know you talked last year in your last webinar about this, but you know, the whole idea of what we do, these home and community-based services, you know, reducing exposure by social distancing has been challenging, and then some. Even though these social and human services aren't medical services, they're still important as they support all older adults, you know, as we all get older. Just a real quick, brief explanation of our structure. Department of Elder Affairs is a standalone state unit on aging. We have 11 area agencies on aging, over 53, I think it is, what we call lead agencies, and numerous providers. And obviously, they've met the challenge of COVID head on and continue to provide essential services under very difficult circumstances. And if they're able to, they have been going to clients' homes with appropriate PPE. And when the home visit's not possible, they still have making thousands of telephone calls to check on homebound seniors, shopping assistance, delivering groceries, medications, telehealth. You know, so it's been incredible to sort of see the aging networks in the States stand up and sort of be counted. And I think they should be called home healthcare heroes, because they've been doing a fantastic job, like I said, under very difficult circumstances. You know, since the pandemic began, it's been a constant and precarious balancing act between the limiting the spread of the virus and also the need for life to go on. And in few places has that balance been more delicate than in those long-term care facilities, where those elderly and medically fragile residents have been deprived of visits from loved ones for almost 5 months now, to protect them, to physically protect them from COVID-19. You know, but at what cost? You know, while social isolation has increased for seniors aging at home, it's become even more pronounced for those individuals in long-term care facilities, as Sarah was talking about. And that increased socialization and loneliness and the impact on the residents' mental health has become very concerning. Here in Florida, we've done what we can. We actually delivered MP3 players, which were donated by the state's Alzheimer's Association to residents to help with them loneliness. And because the areas of the brain linked to memories of music are often left undamaged by dementia, listening to music has become an important part of treating and interacting with persons living with that disease. So music is providing a way to connect, even after that verbal connection has become difficult. And we're focusing on dementia because average residency of long-term care facilities in the nation is about 50% of people living with dementia. Here in Florida, it's about 2/3, which is significantly more. So we have obviously been focused on that, as well as not just people living with dementia, but all older adults. And we find that MP3 players have been very helpful. We've also delivered animatronic pets to residents and as well. And these are not toys. They're an alternative to traditional pet therapy, and they can help give a reprieve to caretakers who obviously are very stressed about what's going on for their residents, their loved ones in their long-term care facilities. You know, there's a study conducted by the Journal for Alzheimer's Disease that found the robotic pets actually help decrease stress and anxiety, but also cause a reduction in the use of psychoactive medications and pain medications as well for patients. And the most exciting thing we did actually was enter into a partnership again with the Alzheimer's Association called Project Vital, which is virtual inclusive technology for all. And that was where we are providing tablets to nursing homes and assisted living facilities throughout the state. And these are not just any old tablets. You know, you can't just turn up to a facility's doorstep and drop off a couple of iPads and say, have fun on the internet, because, you know, on the one hand, we're protecting people at the front door from the physical, you know, effects of COVID. On the back end, if you just give them the license to go on the internet, that's going to expose them to all sorts of neglect, abuse, and exploitation. So these are tablets that are first of all been designed specifically for older adults, and more importantly, they actually have a virtual technology platform that is a very secure platform with designated resources to enable older adults to engage in. It's not just the ability to video chat and email with their loved ones on the outside. It actually has resources like music and books as well. And I've got one here, actually, sort of my show and tell, but it's pretty robust. You can drop them from 20 feet, they don't break. But this guy here, you've got sort of, it shows you his personal page, and then he's got different ways you can go to and explore different areas and stuff. And it's very much, like I said, it's intuitive for older adults. And you can personalize the resident's individual page. And for example, this guy called Joseph, he likes to play checkers. So there's a lot of his stuff on his personal page. He's got his little, I'll show you here, favorites. He's got some spiritual stuff here, and then obviously I think he's Croatian, obviously, so he virtually travels through Croatia. Then he's got checkers on there too, and he loves jazz and dancing in the moonlight. So he goes into these different things and has a good time. So, you know, in between visits, we know that people are very lonely, and this obviously is going to provide help when those visits get restored, because you know, and so people can engage. So we're pretty excited about that ability. And so again, it's the virtual technology platform. But what the Alzheimer's Association has done is overlay it with what they call Project ECHO, and that stands for Extensive Community Healthcare Outcomes. And it's a specific dementia platform that residents, but also the staff, can really sort of learn from and access resources that can help the staff interact better with their residents. And so we're finding that very, very useful. You know, we're excited about the potential for that. In the last 3 months, there've been over 10,000 video chats made from the tablets, and over 20,000 other uses as well, like the virtual travel and the board games and stuff like that. And I think we recognize that these initiatives have been successful and will continue to be so, but especially for the many, many long-term care residents who have no family members to visit them. You know, but for those lucky ones that do have families that want to visit them again, these initiatives were always meant to help just a bit until that day when closer contact may be permissible. You know, everything we've done to this point has been to bring us to this point where we can once again look how to balance the physical health with the need for spiritual and mental well-being. And I have been serving on the governor's task force for the limited and safe re-entry of visitation. I actually, at 2 o'clock, I have our fourth meeting to discuss the recommendations, which is looking at how we can sort of safely and in a limited capacity help people revisit those individuals who are their loved ones in the facility. So it's a very difficult topic. You know, 5 months is an awful long time to be away from family. And so, but again, at the same time, as Sarah said, we have to protect residents' physical health. So we're looking at how to balance that as we go forward. I know last webinar you did talk about the impact of social isolation on older adults living in their homes and communities. So I'm not going to go into that aspect. Just to say that we have our own initiatives to basically around information sharing. We have a Talk It Out flyer. I'm watching the time, 1:30, I think I'm good. We've created a flyer here which is called Talk It Out, and the meal delivery that goes on, we put one of these in our meal delivery bag so everybody gets this, and it has some specific resources that and numbers that you can access if you're feeling lonely or depressed or stressful, which is understandable because we all are because of what's going on. And so that's pretty exciting. And we actually teamed up with ARP, coming up with these 3 do's and don'ts: stay home, stay healthy, and stay connected. Over 100,000 of these have gone out to people living in remote areas, rural areas, so they can understand sort of how to stay safe during this difficult time. And in actual fact, that Talk It Out flyer, our local Department of Health has actually sponsored billboards throughout the state. So Sarah, you can talk to your bosses over there, and maybe they'll do the same thing where you can actually get these, you know, these flyers on these billboards so people can sort of know how to contact. But most importantly is what we have done is actually created through a company called LeadingAge, coming up with a way to do a survey. And what that means is you can actually sort of do an online survey where you fill out some basic questions, confidential, basically your age, your sex, and maybe some health conditions that you may have, and it asks you to review your decisions with how you're living your life through COVID. And then it spits out a sort of a safe report, and it tells you about what your risk is of getting COVID, and then how your behaviors are doing, a safe behavior thing, and then what you can do to improve that that behavior and lessen your risk. It's called, you can have a look at it. It's called floridasafesurvey.com, floridasafesurvey.com. And if you put in the zip code 32301, and then you can just play around on that. And if you like it, I would get hold of your local Department of Aging and sort of encourage them to, and I'll share that information, but it's really, really useful at having people restore some semblance of control over their lives. As we want to safely re-engage, this can help you determine what you can do out there to safely re-engage and still live your life. So we're excited about that that aspect too. So at that point, I think I'm going to turn this over to Melissa now, and obviously we'll answer questions later on. So thank you.
Secretary Prudom, I have a question for you real quick, if you don't mind. What's the utilization been of that SAFE survey? Do you know?
I do. It actually got rolled. What's today? Today is Tuesday. It got rolled out last Thursday, and we've had 6,000 surveys completed since then. We need to do better with getting the marketing of that out. ARP is going to be helping us, United Way, the AAAs, the public health units. So we're going to get the messages out to all the communities to encourage people to fill out what is, again, confidential but a very informative survey about what your risk is and what your behaviors are to mitigate that risk. So we're excited about it, but we're going to be pushing more out there to get people to sort of to take it.
Great, thank you. So, you know, the challenges of COVID that we know have been immense, but there has been some opportunity. And when I, think about the challenges that our long-term care providers have faced, staffing, testing, PPE, finances, reputation, admissions, consumer trust, regulations, reporting, and social isolation, the list is long. But they've also presented opportunities during this pandemic. And Sarah mentioned this, and I'd like to reinforce just the incredible stakeholder engagement that has happened across the Commonwealth to try and support the providers during this pandemic and support, all of our communities. So these opportunities have come up in a variety of areas, and I'm going to kind of break them down a bit. So one is design. You're looking at pictures right now of hugging stations. So this was actually an organization that my husband works with, where they created these hugging stations so that folks could come and be able to give one another a hug through plastic. They're cleaned, obviously, disinfected between each visit, and they had some challenges trying to decide how they could clean out the armholes, and so they got veterinarian gloves that they use with like cows and horses for a birthday, I guess. And so those are disposable, and they can put those in, and people can hug their loved ones. So then there are other members who have created outdoor visitation. They're like plexiglass rooms so that people can see their loved ones as well. That's similar to that window visit, but if you're on the third floor, you don't want your loved ones to scale it like Spider-Man. So creating those outdoor spaces to do that. And Martina, you can just go to the next slide whenever you want. I'm going to share some other things. The other piece of design I wanted to mention, so, the opportunities around really understanding the importance of that small house design in long-term care. So for providers who already had small houses, greenhouses, whatever you want to call them. So it's a cohort of residents that live they each have their own individual bedroom, but in the middle is a living area and a kitchen. You often see this in memory support. And so it's really hard to keep people living with Alzheimer's or dementia in their room. There are just total challenges around that. But if people are cohorted, because of the design of the facility, then that social isolation is reduced and the risk is minimized because it's 8 residents or 12 residents, their caregiving staff is consistent. So I think that those providers who already had that small house design, it really helped a lot in terms of navigating that social isolation. And I think we're going to see a continued push as more communities reinvent themselves utilizing that design. So you think about, instead of a hub and spoke, you've got people living in a common space together. You know, really looking at community engagement. So I got this slide or this picture from a friend the other day and colleague, and, you know, they brought a petting zoo. They brought the horses to the residents, and, you know, how awesome that is. Dr. Prudom mentioned the Robotic Pets, and I wish I had mine here. I lent it to a colleague, and I will mention that those are good when you have to take your child to the dentist as well. They also help with soothing, and they're incredible the way they purr and they respond to you. So I think this creativity around how do we bring pet therapy here, it's equine therapy. They're outdoors, they're safe, and they're still able to enjoy that. You can go to the next one too, please. And here's where I mentioned one of those. This is a drive-through station that one of our members, Beth Shalom Village, had constructed. So their loved one could be in the car and they can still talk to one another and they can be socially distant. So just this incredible creativity and thinking through how can we still have face-to-face interaction, but comply with all the guidance. There's still compliance there. I know you'll agree. Because we are trying to balance, you know, keeping people safe, but bringing smiles to their faces. And let's face it, with COVID, there hasn't been a lot to smile about. Dr. Prudom mentioned technology, and that has been huge. So, you know, early on, CMS gave grants for providers to obtain iPads. DMAS helped with that effort. And so there were lots of folks who didn't have iPads before who were able to get them for their communities. One of our members who created the Birdsong Tablet, which is very similar, Dr. Prudom, to what you were showing us, they made the technology or the website available to everybody, and that has the books and the music and the travel and everything that Dr. Prudom shared. That in Florida they had that available for folks. We had a wonderful benefactor who helped us create LeadingAge Virginia TV. So our members could access this special TV station. It's got exercise on it. It's got comedy. It's got poetry readings. They've got prayers, you know, for different denominations. So just really looking at how, instead of just sitting down and turning on your Netflix account, how we could create programming that was really specific for the people that needed it. I know early on in this pandemic, my husband was buying up iPads as quickly as he could so that the folks that were losing their fight in their nursing homes could have a FaceTime screen time with their loved ones. So really thinking about, we know that we would all much rather be in the same room with one another right now. Maybe not in Florida in August, but perhaps in Virginia, we'd welcome you to Richmond, although it's pretty hot here. So we know that technology can't replace the face-to-face, but I think our providers have learned to leverage it, you know, to help people connect with their loved ones that they haven't before. I heard a story the other day, one of our members, one Sister Canterbury, Chesapeake Bay, they have a resident who now, I think she Skypes with her son every week, and she had never done that before. So she's learned a new technology. It's created a routine connection for them. You can go to the next slide, Martina. So we've talked about technology and design. Then there's programming. So, you know, parades have been a big thing. We know that. We saw those with high school seniors who are graduating. It's been the same in long-term care, folks driving by, and I'll share some pictures of that in a moment. Outdoor wellness, that has been something, you know, to think about as well. So for our members who have a continuum of care, that have independent living residents as well, they have taken advantage of going outside, being socially distant, and still being able to do some exercises. Hallway bingo. apparently is a thing. Hallway sing-alongs and hallway bingo is something I heard from our member Beth Shalom here in Richmond, actually, the hallway bingo. Virtual concerts. Dr. Prudom, you made me think of this one from one of our members, Shenandoah Valley, Westminster, Canterbury, that they had a campus-wide music video project. And so they had staff and residents participate, and they personally wrote songs about what this experience has been for them. So I can share that link with Martina if anybody wants to check that out later, because apparently it's had 17,000 views on Facebook.
Wow.
But looking at how can we leverage people's talents. There are others who have put together chime concerts where residents are in their own rooms, but they're virtually creating this music together. The picture you're seeing on your screen, I love this. So this is Goodwin House. Their residents, socially distant, are participating in our virtual awards ceremony that we had last week. And they were participating because they were winning for their advocacy group, the Silver Panthers, who are out there advocating for not only our field, but if you, any of the recent protests that have happened, they've been on campus with their signs, socially distant. They miss being in marches, they say, but they know that that's not possible for them right now. So here are some residents of Goodwin House seeing that they won that award. The next one, please, Martina. Yeah, the other thing that we've learned a lot about through this pandemic is the importance of organizational culture and leadership. And that the providers who have a really strong culture, which is person-centered, and that's both for the resident and the staff, they've figured out a way to make the most of this in just an incredible fashion. Early on, one of our members had the very first confirmed case, and I remember being on the phone with the CEO, and he was delivering bagels to all his staff. And I said, how is everybody handling it? And he said, I don't know how, but people are still smiling. Now, don't get me wrong, it has not all been smiles, and we know that, because when people die in long-term care communities, they are like family to the staff that work there. These are relationships that they have built over years. So they are losing loved ones just as their loved ones outside of campus are. So it's important to understand the traumatic impact that has on the caregivers who are doing this work day in and day out. But I love this from Vincent Hall in Northern Virginia. They made their own ice cream delivery truck. I don't think they have the bells on it or the music, but you know, looking at ways to brighten residents' faces, but also staff. I mean, this is not what they normally do, these staff members, and you could see, you know, their eyes are smiling, even though we can't see their smiles through their masks. So creative ways to just be able to see a different face than you would normally see. Next one, Martina. I mentioned parades. So, and this is VMRC, a member of ours out in Harrisonburg, and Catherine turned 100. And so they did a parade in front of her home with staff and family members. And you see in the center, that is her care partner who is showing her a card that somebody made for her. So again, you know, it's not the same as a party all in the same room, but I know you've all seen example upon example of virtual birthday parties. And the people who are in the room with them are the caregivers, are the staff of our communities. And so I think it's just important to remember what an integral part they are. And it's true, they are heroes, the staff of long-term care communities. So, you know, we've seen examples of innovation and creativity to solve or at least counter the social isolation problem through technology, through design, through programming, through culture, and through community engagement. I've heard from some members who have partnered with area high schools where the students were calling their residents. And from there, they've developed pen pal relationships. You know, they're keeping in touch. So the opportunity for intergenerational relationships that didn't exist before. So there are just so many examples of people wanting to do what they can to support our older adults who are living in long-term care through this isolation. It's not the same as hugging your daughter. I assume that my mother would say that, but it shows that there's an incredible creativity. And I think with that brings an opportunity for not going back. So we don't know where this pandemic will take us or how long, and we've got flu season coming. So I think the opportunity to reinvent the way we look at programming, resident engagement, person-centered care and service, we can look at them through new lenses because we've learned so much during this past 6 months, and we'll continue to learn moving forward. Did I have any more slides, Martina? I couldn't remember.
You don't have any more slides,
Okay.
but we have several questions if you guys are ready for questions.
Totally ready.
Totally ready.
All right, give me 1 second and let me pull them up. They've been coming in as we've been going. Let's see. I am a volunteer coordinator at a AAA in Virginia. What volunteer activities would be helpful during phase 1 and phase 2 to assist socialization at this time?
Well, I mean, I would think to first reach out to the providers in your area and see what they need and look at some partnership possibilities based on everything that I've mentioned. I think what Secretary Prudom mentioned about residents who don't have family, there's a unique opportunity to engage with them either through video chat or the old-fashioned telephone. So I think, thinking about who are the providers within your network that you probably already have relationships with, and then reaching out to them to see how you could partner. That would be my thought. Sarah, Secretary, do you have additional thoughts?
No, just to add to that, telephone reassurance is proving to be really have a huge impact. We do about 45,000 of those a month, and I think that's something that the volunteers can do in a safe way too. And some have actually sort of engaged in meal delivery, which again is socially distanced, and also using that opportunity to have a conversation with the recipient of the meal as well. But like you said, reach out to your local area agent on aging or your provider and ask what help they may need, because every situation is different in each community. But thank you for the volunteering of that, because volunteering is really shown to be it's heartwarming to me to sort of see that, because of all the other issues of selfishness and stuff that's going on. To see people standing up and saying, I want to help is fantastic. It really is. And the different ways to do that in your communities.
In Virginia, we've also had the Medical Reserve Corps, both essentially working and volunteering in many facilities across the state. So I think they would also have probably some knowledge just about that area of the state that you're in and the needs of those communities. And I would be happy to connect you with that group as well.
Great. I know that Secretary Prudom talked about Project Vital, but Melissa also mentioned the Birdsong Project. So we know that there's several of these projects to integrate iPads and tablets into long-term care facilities to combat social isolation. We've gotten a couple questions specific to the Secretary about, how does the funding work? What company are you working with? I'm not sure I can speak to Birdsong. That was covered a lot in our webinar in the previous month, so people could go back and watch that. But Melissa or Sarah, if you have any ability to speak to that, I think people are looking for some information on any of those projects.
Yeah, and here in Florida, when the states receive money from the federal government, specifically CARES money, every state on aging has the ability to sort of take an administrative percentage off that, top of that, to provide oversight. I did that, but I'm using those funds to help pay for establishing the tablets and the virtual technology platform in those facilities. I don't need to keep money for admin overhead at all. So I'm using that way to finance this. But the other way is, and Melissa can talk more about this, is that civil money penalty funds that exist when long-term care facilities are fined for some violation. It goes into a huge pot of money, and the feds are making that available for facilities to invest in this medium. And before I move on to Melissa, real quick, the company that we're dealing with is called IN2L. It's never too late, IN2L, and it's been fun working with them because to them it's been to them they'll say it's the most socially responsive project they've been working on. They're very excited. But as you know, there's different ways to address this through technology. It depends on where your community is. I think that it should not necessarily just be the federal, the state government, but I think we should challenge the communication companies to step up and ensure connectivity throughout our communities. We should have health insurance companies look at doing this too, because I think that there's a value to doing this in long-term care facilities and in homes and communities, and looking at insurance companies and others to be better community partners and invest in this technology for the future. Because Melissa said it earlier on, this is the new way of doing things, is technology. And so community partners need to step up and be a part of the solution to that.
Yeah, I would just echo that and say, if we've learned anything around going back to school, it's that connectivity is everything, because there are still counties in Virginia that don't have good connectivity. So if they don't have them for students, that means that they don't have them for residents in long-term care. So I think that's a really good point. And I would echo that some of our members have utilized this technology due to the CMP funds that they received, partnering with either INTL, and I know that group really well too, or the folks at Birdsong. And so, you know, you can go to either of their websites or reach out to me and I can connect you if you're interested.
Great. So we had a couple questions about the difference between staff entering a facility and families entering a facility if the family is following the same guidelines. One of the questions, and there's several that kind of fall in this category, are there any facilities in Virginia, I would say, or Florida, we could speak to that, that have opened to visitors as long as they're following the same guidelines as staff? So what is the difference between a staff member and a family member if we're all following the same guidelines?
Sure, I can start, and Melissa, feel free to chime in. So staff members and visitors alike are both being screened, or should be screened upon entry to the facility. And so that would typically include a temperature check and a check for other symptoms. CDC and CMS also recommend staff testing on a regular basis, especially in phase 1 when the facility is starting to reopen and sort of get a handle on where they are and if transmission is still occurring in their facility. So if transmission is occurring, if they're in an outbreak, staff would be tested. And then we had all nursing homes do sort of baseline testing. And a lot of that happened in June and July in Virginia in nursing homes. And so staff were included in that testing. And then if there were positives identified or if there was ongoing transmission in the facility, the recommendation was to continue to test staff weekly. And so, you know, that testing hasn't been extremely straightforward. It's been one of the limiting resources of this response as a whole, not just in long-term care, but across the board. So, you know, testing hasn't gone perfectly as planned, but CMS and CDC continue to stress the importance of staff testing in these facilities, especially in nursing homes. And CMS is actually working on sending out antigen testing, point of care testing devices to nursing homes, including in Virginia, but across the country, to do regular staff testing as well. So family members and staff members should all be screened at the door, should all adhere to universal masking and those kinds of precautions, but there is the recommendation that staff undergo more frequent testing because they're in such close contact with the residents.
Yeah, I would just add to that, so I think it's really important for people to remember that providers want families to be able to come back. This is not like providers don't want you there. Of course they want you there, but we're operating under guidance from CDC and the Department of Health around when it's safest to do that. So I know that some organizations that offer the full continuum, so they have independent living, assisted living, and nursing homes, that some of them are asking for family members to bring that negative test result. If they want to come in, they are allowed to go directly to an apartment and then, you know, directly out of the building, so there's no loitering or hanging out in common spaces. But I think what's really important to remember is that because of the guidance, because of the limitations with testing and how long it can take to get test results back, staff and family members just aren't the same right now. And I thank you, Sarah, for nodding, because I feel like you're affirming what I'm saying. And so, you know, providers are really, they're not making the call, they're adhering to the guidance because of the community spread, and they have more control over staff testing and PPE than they necessarily do over family members. So.
And in Florida, obviously, we're looking, the task force meeting is in about 2 minutes, which I have to get off the call, unfortunately, for that. But yeah, which is the same thing. It has to be in conjunction with what CDC is looking at, and it has to be limited. It has to be safe, and it's a very, you know, careful, delicate, emotional decision making that has to be done, because it's people's lives, and it's tough. But unfortunately, I do have to get off. So, but again, I really enjoyed myself. And if anyone has any any further questions or information, please contact me. Martina has my information. So you all have a good day, and we'll talk again soon.
Sure.
Right.
And I just wanted to thank each of you. I know the secretary is hopping off. We do have a couple other questions that we'll follow up with each of you. And I want to thank Sarah and Melissa as well. I know that the meeting that got scheduled for the secretary was last minute, so we just want to be respectful of everybody else's time as well. Again, this is the contact information for each of your presenters. They welcome any emails. I would encourage you to put VGCOA webinar in the subject line whenever you're contacting them. This webinar, again, is recorded, and it will be posted this afternoon on vgcoa.com. I also mentioned earlier that we'll send out an email to all participants with the link to the webinar. A couple people have asked for a couple of pieces the secretary showed, as well as some other links that our presenters mentioned. We'll include all that information, as well as a survey. We design and pick these topics based on the feedback that we get from our attendees, our presenters, our program committee. So your opinions are very important, and your feedback is very important. So I ask you to take a few minutes just to share your feedback and what we can do to make it better, or share more information. And then again, just as I did in the beginning, I want to thank our sponsors. These are a few of our featured sponsors and exhibitors, but also all of those sponsors and partners that have made it possible throughout this whole transition to a virtual platform. And if there's any other questions, feel free to reach out to us, and we look forward to chatting with you all again next month on the 4th Tuesday from 1 to 2 p.m. Thank you guys so much.
Thank
Thank
you.
you.